back to my story a bit. I told you how, like, the length of my treatment and how it kind of started. So also, because I was so young, a lot of information was told to me, but especially at the very beginning when I was not fully conscious, most of it was told to my parents, of course. And like all information was told to my parents because I was a minor. So I at first didn't know a whole lot, but as treatment went on, I started to learn more and want to learn more about it so that I could understand just for at that moment and for the future. Unfortunately, I don't recall being told about the late risks of what chemo would do to you, because a lot of the time when they find that you have cancer, as long as the parents say they can have treatment, they want to start it as soon as possible so that it does not spread even more. So I personally do not recall being told about any risks for fertility issues in the future, but they may have said something to my parents. I don't remember, or I don't know. They're technically supposed to give options, especially for children who have already gone through puberty, because they already have mature cells. So there are preservation options for both males and females, but like I said, they usually want to start treatment as soon as possible. So a lot of the times they may be offered, but they're not suggested. So for example, females, for those who have already gone through puberty, which means they already have had their period, they can have their egg collected, frozen, and then when they're eventually ready to have a child, it can be fertilized and then implanted back into them, and then hopefully they get pregnant. So that would be for example, IVF. That's essentially what IVF is, but this they'll use later in life rather than right away. And then for females who have not yet gone through puberty, they do technically have the option of ovarian tissue freezing, which pretty much they'll take like a piece of tissue from your ovaries, freeze it, and then implant it back into you or transplant it back into you when you're ready later in life. But that one has not been done a lot. You can't find a lot of doctors that'll do it because it has not been tested a whole lot. Of course it has, they can't offer it without it being tested, at least some, but it hasn't been done a lot of times, so there isn't really a known success rate. So that one's not super, like, it's not suggested as much. Also, for somebody who hasn't gone through puberty yet, I think that they're less, like, their risk for infertility is not as great. I'm not 100% sure on that. Please do your own research about that. This is just based off of what I think, not what I like have researched and know. So please make sure you look at that. So back to preservation options. So for males, they have sperm banking, which is pretty much you collect their sperm in a little cup. The doctors go and freeze it, and then they can use it later in life, fertilize an egg, and have a baby, hopefully. Fingers crossed for them. So that one can only be done for boys who have gone through puberty. And that one can actually be offered a lot easier than egg collection, because all they have to do is it takes like an hour, maybe, give or take, let's say. I don't know, I don't actually know. Whereas like egg collection, you have to make sure that the eggs are mature and they have to have medications beforehand. There's like a whole time. It's like it can take up to a month or two. So it's not as easy for females to do it because, like I said, you need to get the treatment started right away to reduce the risk of spreading cancer. So that's another reason why females aren't really given as many options, or it's harder to give them the options. So males can technically freeze their sperm. The other option that males have for those that have not yet gone through puberty is testicular tissue freezing, which is very similar to ovarian tissue freezing. They just take some tissue from the testicles and they go and freeze it, and then they implant it back into the person, the male, after. But again, just like the ovarian one, they have not done a whole lot of testing on it because they have not had it. Just, they don't really know success rates, so it's not really suggested. But yeah, so luckily there is the option to try to preserve fertility, but it's quite unfortunate that patients aren't usually offered them. They may be like told, or maybe they probably like write it in the ginormous list of side effects and all these things, and here are late effects, and here are things that you can do, that nobody fully reads, because who's gonna sit there and read like 10 pages of stuff? Actually, you should definitely read it. Me as an 11-year-old, I was not gonna sit there and read it. If my mom read it, great. If my dad read it, great. Me, not gonna read it. So it may have said it there, but I don't think that it was something that was truly discussed with my doctors. So that's just something, if you are somebody who's about to start treatment as a child or even as an adult, talk to your doctors about maybe trying to do something to preserve your fertility if you have yet to have kids or you plan on having more. So yeah, and also make sure you do your own research on this. Don't go based on all my facts, because some of them could be incorrect. And like I said, talk to your doctors, please. So lastly, I want to talk about some questions that some people have asked me. So I'll just say the question and then I'll give an answer. All the answers will be opinion based, I believe, because I'm pretty sure all the questions were more of a personal experience type of question. So don't take these to heart necessarily. Great. So my first question was, how extensively did they explain things to you as opposed to them explaining things to your parents? So I think because I was so young, like I wasn't at a point where I couldn't understand things, but I was also young enough to maybe not fully understand. And like I said way before, I was pretty much unconscious for the first like little while. They explained a lot more to my parents than they did me. But as time went on, they did start to explain things more to me. And like my mom, like I was always in the room with my mom, who was usually the person who was with me for treatments because dad had to work, of course. So I was almost always in the room when they were discussing things with my mom. So I would always hear things, but it wasn't necessarily directed at me. It was more directed at her so she could help me type of thing. So I definitely think that they addressed my parents more than me. But like I said, I also believe that I got enough, like as much information as I should have, could have, maybe not could have, but I feel like I got a good amount of information. So that was the first question. The second question is, were you informed directly about the risks associated with fertility and chemo? I answered this earlier, but essentially, I don't think so. I don't believe that I specifically was told, hey, chemo and radiation could make it impossible for you to have kids later in life. And that is really unfortunate because kids are something that are very important to me. I definitely want them in the future. And if it turns out that the chemotherapy has affected my fertility, that would cause me so much heartbreak. I already am currently worried about this. Doing this project was like, oh my gosh. Like every time I was reading more stuff, I was like, I'm scared now. But also now I'm more informed, so I can make sure that I'm looking out for things and making sure that I talk to my doctors and just stuff like that. So initially, no, I was never talked about the fertility part. Even I still go to the doctor every so often just to make sure that like nothing's wrong. And they still have yet to say anything, so that is really unfortunate. But yeah, so that was question 2.